Till now in our series of pharmacology, we have discussed about the nature and sources of drugs and the different routes of administration of drugs. From this video onwards, we are starting with pharmacokinetics, and in this video we will be discussing about the absorption of drugs in the body. Watch the video till the end to understand it well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. If we split the word pharmacokinetics, pharmaco means drugs and kinetic means movement. Thus, pharmacokinetics is the movement of the drugs within the body, through the body and out of the body, or else we can say it is the effect of body on the drug. It comprises of 4 factors: absorption of the drug, distribution of the drug within the body, the metabolization of the drug and excretion of the drug, and this can be remembered with ADME. Starting with the absorption, there are certain key points which need to be remembered, which will simplify the entire concept of absorption for you. So drug, whenever consumed via the oral route, has to cross the membranes of the GIT and the blood vessels, or we can say a drug whenever consumed via oral route has to cross the biological membrane. Always remember key point number 1, only lipid soluble drugs can cross the biological membrane. A drug, key point number 2, a drug would be lipid soluble whenever it would be in the unionized form. A drug can be present in 2 forms, either unionized or ionized. In the unionized form, the drug is lipid soluble, while in the ionized form, the drug is water soluble. So, for the drug to cross the biological membrane, it has to be in the unionized form, and then only it would be lipid soluble. So, if we talk about the acidic drugs, the acidic drugs would obviously remain unionized in the acidic medium, and thus would be lipid soluble, and thus would cross the membrane in the acidic medium itself, for example stomach. On the other hand, the basic drugs will remain unionized in the basic medium and thus would be lipid soluble in the basic medium itself, and thus would cross the membrane in the basic medium. So we can conclude key point number 3, whenever the medium is same, the drug can cross the biological membrane. Acidic drugs would cross the membrane in the acidic medium. Basic drugs would cross the membrane in the basic medium, because in these mediums, these respective drugs would remain unionized and thus would be lipid soluble and thus would be able to cross the membrane. Some example of weak acids are barbiturates, NSAIDs, methotrexate, sulfonamides, penicillins. Some example of weak bases are morphine, atropine, amphetamines, quinine, hyoscine, etc. Let's try to simplify the concept of ionized drugs and the unionized drugs. It can be explained with the help of Henderson-Hasselbalch equation, which is given in the video. So, simplifying this entire concept, key point number 1, whenever the pH is equal to pKa, the drug is 50% ionized and 50% unionized. That means 50% of the drug is water soluble and 50% of the drug is lipid soluble, as we have already discussed. Whenever the pH becomes greater than pKa, the entire medium becomes alkaline. As we have already discussed, when the medium is same, drugs can cross the biological membrane. That means in the alkaline medium, only the basic drugs can be absorbed because of more availability of unionized form of drug. Thus, the drug becomes lipid soluble, which can cross the biological membrane. On the other hand, acidic drugs in the alkaline medium gets ionized, which are water soluble and not lipid soluble, and thus cannot be absorbed in the alkaline medium. Whenever the pH is less than pKa, the medium becomes acidic, into which only the acidic drugs can be absorbed because of more availability of unionized form of drug, thus lipid soluble form of drug, which can cross the biological membrane into that acidic medium. On the other hand, basic drug becomes ionized in the acidic medium, because of which they are not in the lipid soluble form and thus cannot be absorbed in that medium. Overall, the entire gist of absorption in pharmacokinetic depends upon these points. The drug has to be lipid soluble when it has to cross the biological membrane. The drug would be lipid soluble only when it would be in the unionized form. The drug would be in the unionized form when it would be present in the same medium. Now there are two very important terms which are discussed in absorption. Number one, bioavailability, and number two, bioequivalence. Let's discuss about bioavailability now. If we split the entire term bioavailability, it means bio plus availability. So we can conclude that this has something to do with the availability of drug in the body. Expanding this concept a little more, whenever a drug is administered orally, it has to be absorbed into the portal circulation to reach the liver. Now, after the drug reaches the liver, it has two fates. Some of the drug gets metabolized in the liver. This entire phenomenon is called as first pass metabolism or pre-systemic metabolism. The second fate is the remaining amount of drug reaches the systemic circulation. So the fraction of drug which reaches the systemic circulation in the unchanged form is called as bioavailability. That means the fraction of drug which is actually available to show its effect is called as bioavailability. It is to note that bioavailability is 100% by the intravenous route. That means the drug which are given via the intravenous route does not undergo first pass metabolism or does not get metabolized in the liver. Thus, 100% of the amount of drug is available to show its effects. Bioavailability is determined by two factors. First of all, depends upon how much drug is absorbed within the portal circulation, that is absorption of the drug, and number two, the first pass metabolism, that means how much drug gets metabolized within the liver. So if we try to remember the drugs with high first pass metabolism, that means the drugs which get largely metabolized within the liver whenever absorbed into the portal circulation, it can be remembered with the mnemonic. Nitrates have large pre-systemic metabolism. The drugs are N-nitrates, have means hydrocortisone, large means lignocaine, pre means propranolol, systemic means salbutamol, metabolism means morphine. So nitrates, hydrocortisone, lignocaine, propranolol, salbutamol and morphine have high first pass metabolism. The mnemonic is nitrates have large pre-systemic metabolism. To calculate the bioavailability of the drug, it can be first of all done by comparing the excretion of that drug in the urine. The second method of calculating bioavailability is to plot the graph of plasma concentration of the drug versus time. So whenever a drug is administered, the plasma concentration of the drug increases with particular time. At a certain point of time, that plasma concentration of the drug becomes maximum. So the maximum concentration of the drug can be denoted via Cmax, and the time at which the maximum concentration of the drug is achieved is called as Tmax, which tells about the rate of absorption. Eventually, with time, the plasma concentration of the drug within the body decreases, thus giving us a bell-shaped curve. This bell-shaped curve, the area under this curve tells about the extent of absorption of the drug, that is bioavailability. Thus, bioavailability can be calculated by comparing the area under plasma concentration time curve for the IV route and for that particular route. Now let's try to understand the graph with the help of an example. We have three drugs, drug A, drug B and drug C, absorbed within a particular time, achieving a particular plasma concentration. If you just look on the time axis, then the rate of absorption of C is fastest, followed by drug A, followed by drug B. However, therapeutic concentration of the drug is achieved only by the drug A, having the highest plasma concentration among the drug A, B and C. However, the bioavailability, that is the extent of absorption of drug, which is demarcated by the area under the curve, is equal for the drug B and drug A and is least for drug C. Please observe the figure. Now let's learn about the second term, that is bioequivalence. Splitting this term into two, bio plus equivalent. Let's suppose there is a drug XYZ produced by two different companies, and the similar drug produced by two different companies have same salts into it, same doses of that same salts into it with the same dosage forms as well. Now, if these two drugs having the same salts, same dose, same dosage forms, if the difference in the bioavailability between these two products produced by two different companies is less than 20%, then the drugs are said to be bioequivalent. This implies that these two products or these two drugs are biologically equal and will produce similar plasma concentrations. So this was an attempt to simplify the entire concept of absorption for you with the help of certain key points, so that you can first of all understand the concept and then memorize in the long run. Thank you for watching the video. The next video will be about the metabolism of drugs in the body. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.